Today's topic is vaginal pain, and I've gotten a lot of questions about this in a variety of contexts, and so I want to cover some of the most basic causes of vaginal pain to some of the more obscure or less understood causes of vaginal pain, keeping in mind that I am a pediatrician, and so much of my content is going to be directed toward a younger audience, so sort of the adolescent audience. And that doesn't mean that if I don't talk about some specific things that sound like what you're going through, it doesn't mean that that doesn't exist. There are other causes for vaginal pain that happen as we age and that are also circumstantial, like having a baby and after having a baby. And so I'm going to focus more on the adolescent population. Now, the other thing I want to share is that most of, at least the starting place to go for a lot of these concerns is going to be your primary care doctor. So your pediatrician through the age of 18 to 21, family medicine provider as well. And then you can also, if you have an obstetrician gynecologist, so OB-GYN, certainly take your concerns to them. But the treatment can sometimes be very straightforward. So bringing this up with a primary care provider may give you the answers that you need. Other times we might need a more complex and comprehensive team involved in care for these concerns. And so it's nothing to be nervous about. Just know that sometimes the treatment is a little bit more straightforward, and other times it might require the involvement of an OB-GYN, a physical therapist, mental health, or even a dermatologist, so a skin doctor. The point of all of this is just to let you know there are a variety of causes of vaginal pain, and don't get discouraged if you are experiencing this. You are not alone, and we have a lot of treatment and evaluation tools at our disposal. So don't feel alone, don't feel nervous. It's okay to bring this up to your doctor whenever you're ready. Okay, so for starters, I want to define specifically vaginal pain in the context of both penetrative, so penetrative being sexual or asexual, penetrative sexually with penis, finger, toy, or asexual being like a tampon, a menstrual cup, or a speculum, so a tool that a doctor might use. So penetrative on the spectrum then to non-penetrative or spontaneous, which might occur with irritation from underwear or tight clothes, to riding a bike or other activities that put just a lot of pressure on the vaginal area. So vaginal pain can be this big spectrum of penetrative to non-penetrative or spontaneous. The most basic cause of vaginal pain with penetration, which I talk about a lot, is going to be related to that first time with intercourse or penetration. And there are a few different causes for just the most basic, easily to address cause of vaginal pain with penetration. First cause might be muscle tension in anticipation of vaginal penetration, and so relaxation, lots of foreplay can certainly help relax things and make vaginal penetration a little bit more pleasant. A tighter hymen or skin that surrounds the vaginal opening can cause some pain with the first few times of vaginal penetration, as well as it tears or stretches. And then insufficient lubrication is also a big cause of pain with vaginal penetration. And so whether that is with sexual activity, so with the insertion of a penis, a finger, a dildo, or sex toy, making sure that you have sufficient lubrication. And then even a tampon, you can use a water-based lube to help with the insertion of a tampon as well, if you're worried that things are a little bit dry down there while you're trying that out. So that's just the most basic first penetration, some causes of the first time with penetration, what might be causing some vaginal pain. Next level up is going to be infection. So infections are a very easy to identify, easily treatable cause of vaginal pain. They can be not sexual in nature, so yeast tends to be less sexual in nature and more just because some people are more prone to yeast infections. Other times use of antibiotics can predispose you to a yeast infection, and so things you want to look out for are going to be some vaginal pain potentially, and then irritation, so severe itching or burning down there when you pee, and then a kind of a chunky white discharge as well. It doesn't usually smell, but again, you can have a lot of irritation and pain in the private area. The other thing that is not necessarily sexually related that can cause vaginal pain is going to be bacterial vaginosis, and that is going to be a specific, just a bacterial overgrowth of the vagina. You can feel some vaginal pain, irritation. You might also notice some abnormal smells, so it might be a little bit fishier, your vaginal discharge, and vaginal discharge might also be a little bit more yellow or green in color. Both of those are easy to diagnose and easy to treat if you see just your general provider. And then infectious causes that are related to sex. Herpes causes very painful lesions in the private area, so you might notice a little blister or like an exposed red lesion in your private area. Super painful, super tender, similar to a cold sore but in your genitals. Yes, so that would be something to consider if you have vaginal pain and you notice like a blister or a lesion in your private area. Talk to your doctor. We can certainly help give medications to improve the pain and make your herpes outbreaks much shorter. Gonorrhea and chlamydia don't always have symptoms, so just something to be aware, but two sexually transmitted infections that can cause pain with penetration. So if you're experiencing any pain with penetration and you haven't been checked for a sexually transmitted infection and you are sexually active, it's worth getting those checked out, easy to treat, and should help with your vaginal pain. The next area of vaginal pain causes is going to be inflammatory, and that's generally related to skin conditions, in particular things like lichen sclerosis. Usually that is going to be diagnosable with visual inspection. If you have any concern about a skin condition in your private area, talk to your doctor. We can take a look, either do a biopsy or send you to a skin specialist to see if lichen sclerosis is potentially the cause of your vaginal pain. And then the next area of vaginal pain is going to be something called vaginismus, and that is defined as the uncontrolled or involuntary contraction of the muscles surrounding the vagina in anticipation of vaginal penetration, whether sexual or asexual. So again, penis, finger, toy, or tampon, speculum, menstrual cup. This is a diagnosis that involves both vaginal pain and some emotional distress associated with anticipated penetration. It is oftentimes associated with previous trauma or sexual trauma specifically, or a thought process around sexual penetration, whether cultural or religious, that then instills the emotional dread or anticipation of vaginal penetration to be traumatic. And so it doesn't always have to be. This can also be without those causes as well, but a lot of times it is associated with a history of sexual trauma, or the personally held belief that there is some sort of negative result of vaginal penetration. The good news is that there are some treatments for this. Because it's thought that there is some sort of muscle contraction component to the pain, physical therapy, and specifically pelvic floor physical therapy, can be helpful for individuals who experience this anticipated pain. Desensitization techniques, so desensitizing that pain associated with penetration, particularly with the use of vaginal dilators. And then mental health as well. So some therapies can also be beneficial for reducing the anxiety and stress surrounding anticipated vaginal penetration. So if you're concerned that this might be something that you're experiencing, talk to your doctor. And then lastly, I want to talk about vulvar pain syndrome, or vulvodynia. There are a variety of terms for this, but it's right now the term that encompasses most of the older terms is vulvar pain syndrome. And that is going to be pain with touch of the area around the vagina and potentially the clitoris as well. Pain of an unknown cause, so not infectious, not trauma, not otherwise explained by something else, but pain of the vulva, generally the vagina, with or without pain of the clitoris, without a known cause, present for at least 3 months. Now, what distinguishes vulvodynia from vaginismus is generally the lack of that emotional component. So it's not that it is pain with penetration in anticipation of that penetration, but it's more pain with touch is vulvodynia. So we don't know exactly what causes vulvodynia. We do know that it can be associated with other conditions as well. So people who have things like fibromyalgia, chronic bladder irritation, or irritable bowel syndrome often have higher rates of vulvodynia than those without, but it's certainly possible to have vulvodynia without any of the other conditions that I just mentioned. And again, the good news about this condition is that we have a lot of things that we can do to help treat vulvodynia. And so the most basic things are things that you can do at home by yourself. So reducing anything that causes or exacerbates some of that vulva pain. And that's going to be from wearing looser cotton underwear, not wearing tight clothes, avoiding pantyhose or tights, and then cleansing regimens as well. So avoiding, don't put any soaps on the vulva, just wash with water. Avoiding any sort of irritating detergents or fabric softeners as well can be helpful for reducing some of the pain associated with vulvodynia. And then if you are having flares, doing things like Epsom soaks in the bath, soaks in bath water can help reduce some of that pain as well. Other things that are recommended for helping with vulvar pain syndrome or vulvodynia include stress reduction. So whether that is through therapy or medication, but figuring out ways to reduce stress. Stress has been shown to be associated with worsening vulvar pain syndrome. And then recommendations for things like lubricants. So whether that is with tampon insertion or with sexual activity, using a lube that is gentle, alcohol-free, no smells, no other irritating chemicals in it, but generally a water-based or oil-based lube that is nice and soothing to the skin can help reduce some of the pain associated with penetration. And then doctors can also talk you through if you might potentially benefit from the use of a topical numbing medicine before penetration as well. The goal being that you deserve to experience pain-free vaginal penetration. And so we can help you with that. And I would encourage you to continue to have that conversation with your doctor. Even if you don't find the fix immediately, it is worth continuing to talk, troubleshoot, figure out what you can do to make your vagina a pain-free area. But this is just a general rundown of some of the things that cause vaginal pain, generally more in younger individuals. But don't be discouraged if I didn't talk about something that sounds like what you're experiencing. There are certainly other things out there, and particularly in different age groups or different populations that might have specific experiences. But it's worth talking to your doctor because you deserve to feel better. And remember, if you have a question for Ask Dr. T, you can either respond in this video or submit through my website, askdrt.net.